Hi again. Haven't done a video in a while, so I thought I was going to do one today and thought of doing one on obstructive sleep apnea, the new treatments. We have talked about obstructive sleep apnea in the past, and we have also talked about a component of it called central sleep apnea. So to understand it, obstructive sleep apnea means the brain is sending a signal to breathe. The muscles of the respirations are working properly and they are initiating a breath. However, the throat muscles, because of stages of the sleep and lack of muscle tone, collapse, causing narrowing of the throat, leading to decrease in the air movement, either to zero or substantially low, causing apnea or hypopnea. So when the air movement is absent in presence of movements of the chest and the belly, it's called obstructive sleep apnea or OSA. When the air movement is reduced but not completely gone, and so the reduction is about 30% of your baseline breath, and it is associated with 4% drop in the oxygen saturation, that's considered hypopnea. And when we have this substantial number per hour, then people have what is called OSA or obstructive sleep apnea. And we talked about this in previous videos about association with uncontrolled hypertension, non-responding congestive heart failure, recurrent irregular heartbeats called atrial fibrillation, to worsening of the diabetes, and many other conditions that are associated with uncontrolled, untreated sleep apnea. So this was obstructive sleep apnea. There's another apnea which is less common called central sleep apnea. Central sleep apnea means the brain center of the breathing is not sending an impulse or command to breathe. So this is central problem. The lung is normal or the throat is normal, the muscles of the breathing and the muscles of the belly, and they are all normal, but they don't get initiation from the center. And so there is no air movement. So in central sleep apnea, there is no air movement, and the chest muscles or chest wall and the abdomen or the belly wall is not moving. So an absence of muscular effort to breathe and leading to an absence of air movement would be considered as a central sleep apnea. So contrast to obstructive sleep apnea, when center is sending impulse, the muscles are moving but air is not moving. This is where air is not moving because there is no initiation of breath or initiation of effort due to lack coming from the center. So central sleep apnea is seen many times in people who have strokes, where they have had damage to the brain. It is also seen in patients who are obese. It is also seen in congestive heart failure, where the brain center, which is stimulated because of lack of oxygen and built up of carbon dioxide, is sluggish, as the blood reaching there is not reaching in time. So the brain center has a couple of stimulations. One is lack of oxygen, second is built up of carbon dioxide, and third is pH or acidity versus alkaline. So an acidic environment will increase the response of the brain center. Lack of oxygen will stimulate brain center. Built up of carbon dioxide will create an impulse from the brain center more frequently. Contrast to that, if you have alkaline pH, if you have more than needed oxygen or reduced carbon dioxide, the center perceives no need to initiate the impulse to breathe, and then you don't have the initiation, so there is no breath. So this is called central sleep apnea. Now, I was talking about congestive heart failure. In congestive heart failure, the blood reaching the center is slowed, the speed with which it is reaching. So the response time is prolonged. And that's the reason people get central sleep apnea. Please remember, this is a very gross explanation and not to exactly what is seen or what is perceived by doctors or by scientists as to the 100% etiology of central sleep apnea and congestive heart failure. But in any case, strokes, neurological disorders, and the congestive heart failure are the main causes of central sleep apnea. So I was going to do this video to tell you about the newer treatments. So there are a couple of 3 things which are new. They're not as new as yesterday, but certainly new on the horizon. Number 1 is called a Inspire. This is a nerve stimulator. So a receiver is implanted underneath the collarbone, typically right collarbone, and you have a remote programmer. So this is like a pacer. The wire from this particular generator is taken to wrap the nerve called hypoglossal nerve. And so you can program it. So if you have an episode where your breath starts going down, this will stimulate and people will have reduction in their apnea, hypopneas. So this is the hypoglossal nerve stimulator. And again, it is a procedure where somebody has to insert under the skin the receiver. The program is done on an outside programmable device. And this certainly has shown significant improvement in patients. I still feel that it is an invasive thing and it takes a while to get adapted to it. Common side effects reported where the problem at the site of insertion, and sometimes when there's nerve is stimulated, people feel that too. So those are the 2 common side effects. I still feel that this is in infancy. The jury is not completely out. The studies definitely show that it helps. So if you cannot tolerate a positive airway pressure mask, this may be an option for you. The alternative treatment that I had talked about it in the past was a surgery called UVPP, which is done by ENT or ear, nose, throat doctor, and also talked about the lower jaw or mandibular advancement devices. Both these things are old, and I talked about it before. Maybe I'll give a little bit more detailed explanation next time. But the second new thing that has popped up on the market is called a tongue muscle stimulator. I think it's called Excite OSA. So essentially what it is that it's a device that is like a C, letter C, and it's small. The actual size is about 2 of my fingers right now. And the C is put on your tongue and you close the mouth. It stimulates the respiratory muscles. It stimulates the tongue muscles to make them more tonic. Instead of limp, they become more stiff. And so you have to use this device, which is battery operated, for 20 minutes a day, every day for 6 weeks. It's like you developing your bicep muscles, or you developing your quads or quadricep muscle, where you do leg push-ups or quadricep muscle exercises or bicep curls to build them up. Here you are building up the tongue muscle. So when you build the tongue muscles over a period of 6 weeks by using it 20 minutes a day, then you can continue to use it 20 minutes once a week. When you're using this is during daytime, not with the sleep, and you don't have to put it in the mouth when you're sleeping. So you can be watching TV, working on a computer, or looking at your phone, and you could still use that device. Certainly you can't talk on the phone because your mouth is closed to keep this device stimulating your tongue muscle. So this is the second one that is available, and it is not covered by the insurance. The cost is about $750, and it is only used for a minor or mild obstructive sleep apnea. These are the two new developments. There are some others that I'll cover next time. I hope you like this information and would subscribe. Thank you. Have a nice day.